Welcome to your health channel. Joints hurt. Number 1. Arthritis. This is a common source of joint discomfort and can be brought on by autoimmune conditions, joint wear and tear, or joint inflammation. Number 2. Injury. A joint injury, such as a sprain, strain, or fracture, can result in joint discomfort. Number 3. Overuse. Especially in athletes and people with physically demanding careers, repetitive use of a joint can result in joint pain. Number 4. Infection. An infection in a joint may result in discomfort and inflammation. Number 5. Gout. This form of arthritis is brought on by the accumulation of uric acid crystals within the joint. Number 6. Lupus. An autoimmune condition that can lead to inflammation and joint pain. Number 7. Fibromyalgia. This illness results in extensive discomfort throughout the body, notably in the joints. Number 8. Bursitis. This is an inflammation of the bursae, which are tiny sacs filled with fluid that act as joints cushioning. Number 9. Tendinitis. Tendinitis is an inflammation of the fibrous structures that connect muscles to bones, the tendons. If you have joint discomfort, it's crucial to consult a doctor so that you can identify the underlying cause and get the right care. Number 1. Arthritis is a condition that causes inflammation in the joints, leading to pain, stiffness, and swelling. There are several types of arthritis, including osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and gout. The causes of arthritis vary depending on the type of arthritis, but can include age. The most prevalent type of arthritis, osteoarthritis, is frequently brought on by the deterioration of joints over time. Genetics. Rheumatoid arthritis and psoriatic arthritis are two types of arthritis that have a genetic component. Infection. An infection may be the root cause of some kinds of arthritis, including reactive arthritis. Autoimmune conditions. In autoimmune conditions like rheumatoid arthritis, the immune system of the body attacks the joints, resulting in swelling and destruction. Lifestyle factors. Smoking, living a sedentary lifestyle, and being overweight all raise the risk of developing arthritis. Joint injury. Arthritis risk is increased by joint injuries, such as those sustained in sports or accidents. Medication, physical therapy, joint injections, and surgery may all be used to treat arthritis. It's crucial to collaborate with a healthcare practitioner to create a treatment strategy that is customized to your arthritis type and severity. Number 2. A number of factors, including falls, sports-related injuries, accidents, and repeated motions of the joints, can result in joint ailments. The method of therapy may change according on the degree of the damage. The following general actions can be taken to treat joint injuries. Rest. Limiting activities that make the ailment worse can aid in the healing of the joint. For a few days, the injured joint needs to rest, especially if it is in discomfort or is swollen. Ice. Ice therapy can assist to lessen discomfort and swelling at the affected joint. Several times a day, 15 to 20 minutes of ice should be applied at a time. Compression. Applying an elastic bandage across the damaged joint might help reduce swelling and support the joint. Elevation. Reducing swelling and promoting healing can be accomplished by elevating the injured joint above the level of the heart. Medication. Nonsteroidal anti-inflammatory medicines, NSAIDs, and acetaminophen, both available over the counter, can help relieve pain and reduce inflammation. Physical treatment. For more serious injuries, physical therapy can help by enhancing joint flexibility and range of motion while also strengthening the muscles around the injured area. Surgery. To reconstruct or repair the injured joint, surgery may occasionally be required. If the injury is serious or if there is ongoing pain, edema, or restricted joint motion, it is crucial to get medical help. The nature and degree of the joint damage will define the appropriate course of therapy, which can be determined by a medical specialist. Number 3. People who do repetitive actions that strain their joints, muscles, and tendons may develop overuse injuries. This can include persons with physically demanding employment, such as construction workers or assembly line employees, as well as athletes who frequently make the same motions, like runners or tennis players. It's crucial to routinely take pauses and rest the damaged joints to avoid overuse problems. Additional measures to avoid overuse injuries include cross-training. By using different muscles and joints, a diversity of workouts and activities can help prevent overuse problems. Technique. Using the right form when executing exercises or motions will help avoid putting undue stress on the muscles and joints. Increasing the strength, length, or frequency of something gradually overuse injuries can be avoided by exercise. Proper footwear is important to wear since it can help prevent overuse injuries, particularly in sports. Stretching. Consistent stretching can reduce muscular imbalances that could result in overuse problems and increase flexibility. In the event that overuse injuries do arise, treatment options may include rest, ice, compression, and elevation of the injured joint, as well as prescription medications such as painkillers or anti-inflammatory drugs. To assist in enhancing joint flexibility and strengthening the afflicted muscles, physical treatment may also be suggested. Number 4. Septic arthritis, also known as infection in a joint, is a dangerous disorder that can result in pain and inflammation in the affected joint. Bacteria, viruses, or fungi that enter the joint through the circulation, adjacent tissues, or a direct damage to the joint can all result in an infection. Septic arthritis symptoms can include fever, joint pain, edema, redness, warmth, and stiffness. If you experience any of these symptoms, you should visit a doctor right once. If left untreated, septic arthritis can damage joints permanently or spread to other regions of the body. Draining the infected joint fluid and giving antibiotics to treat the infection are the usual steps in treating septic arthritis. Surgery can be required in some circumstances to remove damaged tissue or repair the joint. Anti-inflammatory medications and painkillers may also be used to treat symptoms. Maintaining proper cleanliness and getting quick medical assistance for any scrapes or wounds that can become infected are two ways to prevent infection in joints. Additionally, special precautions should be taken to protect joints against infection in patients with compromised immune systems or other medical problems that raise the risk of infection. Number 5. Gout is a type of arthritis that occurs when there is a buildup of uric acid crystals in the joints, leading to inflammation and pain. The exact cause of gout is not fully understood, but it is believed to be related to genetics, diet, and other medical conditions. If you suspect you have gout, you should see a healthcare professional for a proper diagnosis and treatment plan. They may recommend medications to reduce inflammation and pain, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or colchicine. They may also recommend lifestyle changes, such as avoiding foods that are high in purines, e.g. organ meats, shellfish, and beer, staying well hydrated, and losing weight if necessary. Some complementary therapies, such as, may help control gout symptoms in addition to medication and dietary adjustments. Ice. Putting ice on the injured joint can aid with pain relief and swelling reduction. Rest. Resting the injured joint can help reduce pain and speed up recovery. Compression. Wrapping the injured joint with a compression bandage can support it and aid to minimize swelling. Elevating the injured joint can assist to lessen discomfort and swelling. Acupuncture. Some people use acupuncture to treat their gout symptoms. Natural cures. Some plants, including ginger and turmeric, contain anti-inflammatory qualities that may aid with pain and inflammation reduction. It's critical to collaborate with a healthcare practitioner to create a treatment strategy that is customized to your unique case of gout, its severity, and any additional medical issues you might be experiencing. Number 6. Lupus is a chronic autoimmune disease that can harm the skin, joints, kidneys, brain, and other organs and tissues. Lupus' precise cause is unknown. However, genetic, environmental, and hormonal variables are thought to be involved. Consult a medical expert for a correct diagnosis and treatment plan. If you think you may have lupus, blood tests, physical examinations, and a review of a patient's medical history are frequently used to diagnose lupus. Depending on the degree of symptoms, lupus treatment may involve using nonsteroidal anti-inflammatory medicines, NSAIDs, corticosteroids, and immunosuppressants to reduce inflammation and other symptoms. Changes in lifestyle, such as frequent exercise, limiting exposure to sunshine, and eating a balanced diet, may also help manage lupus symptoms. Complementary therapies, such as, may also be beneficial for people with lupus. Relaxation methods. Since stress can cause lupus flares, methods of relaxation like yoga, tai chi, or meditation may help manage symptoms. Acupuncture. Some patients use acupuncture to reduce their lupus symptoms. Herbal remedies. Some plants, like turmeric and ginger, contain anti-inflammatory characteristics that could aid with symptoms management. Massage therapy. Massage therapy may be able to reduce lupus-related muscular pain and stiffness. Working with a healthcare practitioner to create a treatment plan relevant to your type and degree of lupus as well as any additional medical issues you might have is essential. Number 7. Fibromyalgia is a persistent condition that results in broad bodily aches and soreness, as well as exhaustion, sleep disruptions, and cognitive challenges. Although the precise etiology of fibromyalgia is unknown, changes in how the brain and spinal cord receive pain signals are thought to be a contributing factor. You should consult a healthcare provider for a proper diagnosis and treatment plan if you think you may have fibromyalgia. The conventional method for diagnosing fibromyalgia involves a physical examination, a review of medical history, and the exclusion of other medical problems. Medications for pain management, such as analgesics, antidepressants, and anticonvulsants, may be used in the treatment of fibromyalgia. Additionally, making lifestyle adjustments like exercising frequently, sleeping well, and lowering stress may help control fibromyalgia symptoms. Complementary treatments, such as, may also be beneficial for those with fibromyalgia. Massage therapy. Massage therapy may help reduce fibromyalgia-related muscular discomfort and stiffness. Acupuncture. Some people use acupuncture to reduce their fibromyalgia symptoms. Relaxation methods. Since stress can make fibromyalgia symptoms worse, using relaxation methods like yoga, deep breathing, or meditation might help manage symptoms. Cognitive behavioral therapy, CBT, is a form of talk therapy that has been shown to be effective in assisting fibromyalgia patients in navigating the emotional and psychological effects of their illness. It's crucial to collaborate with a medical expert to create a therapy strategy that is customized to your unique case of fibromyalgia, its severity, and any additional medical issues you might be dealing with. Number 8. Bursitis is a disorder brought on by inflammation of the bursae, which are tiny fluid-filled sacs that cushion the joints. It can be brought on by repetitive motions, overuse of a joint, or injury, and it can cause discomfort and stiffness in the affected joint. Consult a medical expert for a proper diagnosis and treatment plan if you think you may have bursitis. Bursitis is often identified after a physical examination and evaluation of the patient's medical history. Bursitis treatment options include rest. Resting the injured joint can help reduce pain and speed up recovery. Ice. Putting ice on the injured joint can aid with pain relief and swelling reduction. Nonsteroidal anti-inflammatory medications, NSAIDs, can be used to treat pain and inflammation. Physical therapy. Physical therapy can strengthen the compromised joint and increase range of motion. An injection of corticosteroids into the afflicted joint may be advised by a medical practitioner in circumstances where the inflammation is severe. Surgery. In extremely rare circumstances, surgery may be required to remove the damaged bursa. Alterations to one's way of life, such as avoiding activities that exacerbate the affected joint, may also assist manage the symptoms of bursitis. It's crucial to collaborate with a healthcare practitioner to create a treatment strategy that is relevant to your bursitis type and severity as well as any additional medical ailments you may have. Number 9. Repetitive motions or overuse of a joint frequently cause tendon inflammation or irritation, which is known as tendinitis. In the affected area, it may result in discomfort, swelliness, and tenderness. You should consult a healthcare provider for an appropriate diagnosis and treatment plan if you think you may have tendinitis. Typically, tendinitis is identified through surgery. In extremely rare circumstances, surgery may be required to remove the troubled bursa. Tendinitis therapy options include rest, giving the injured area some time to heal while also reducing pain. Ice. Putting ice on the injured region can aid with swelling and pain reduction. Nonsteroidal anti-inflammatory medications, NSAIDs, can be used to treat pain and inflammation. Physical therapy. Physical therapy can help strengthen the injured area and increase range of motion. An injection of corticosteroids into the affected area may be advised by a medical practitioner in circumstances where the inflammation is severe. Surgery. In extremely rare circumstances, surgery may be required to fix or remove the injured tendon. Alterations to one's way of life, such as avoiding aggravating activities, may also assist control the symptoms of tendinitis. It's crucial to collaborate with a medical practitioner to create a treatment plan that is customized to your unique case of tendinitis, its severity, and any additional medical issues you might be experiencing. I post every post with concern for your health. Keep watching our videos. I wish you a healthy life. Subscribe our channel and share. Feel free to share your views in the comment box below.